In this module, we're going to talk about the process of the restorative phase of a dental implant and the stuff that we do here at our office. You have an understanding of how it kind of works out, so we know how to schedule and kind of know what the patients are going through in this entire process. So if you remember, we have the implant is put in place. It has been in now place for at least 3 or 4 months. The implant specialist or the one who placed the implant, the oral surgeon or periodontist, has said, okay, they're ready to go. And so now the patient's going to come back to our office, and it's time for us to take over from there and get the implant ready for an abutment and a crown. So what happens is we're now kind of at this age. We're between stage 2 and 3 according to this diagram. So let's say the patient shows up, and they're going to have in place this little covering. It could be either a cover screw, it could be a healing abutment. There are a couple different things we could call this, and we'll go over that in a different module, but they show up with this in place. Now, in the meantime, they would have worn some kind of temporary removable device that goes over this so they don't have to have such an exposed tooth, especially if it's in the front. If it's in the back, they may not have worn any kind of temporary. They may have just left it. But the basic process is this. When they show up for the impression appointment, we're going to take off this little metal piece that's fitted into the implant. And then in its place, let me back up for a moment. There is going to be something covering this implant. Let me go back to this very first slide we saw in the introduction. The implant is this metal screw, and inside of that, it's a hollow area. And that hollow area does allow for the abutment to slide in. But before the abutment slides in, they're going to put in some kind of other covering. It might be either we'll call a cover screw, which is a real thin little screw that goes inside of this, just to kind of cover it, because you don't want gum tissue growing inside of the implant. Or it could be a healing abutment, which is something that's a little bit thicker. I'll explain what that is in the next module. But anyhow, they show up. They have this thing in place. We're going to take this off. Sometimes we have to get the area numb. Sometimes we don't. We just have to just see how well the gum tissue looks, how deep the implant is buried, those different things. But we're going to take this thing off. And then in its place, we're going to put this metal part. And this metal part's actually called an impression coping, okay, or an impression part. We put that in place, take an x-ray, make sure it's seated down all the way. We have to make sure that that is truly on top of the implant 100%. And then we're going to take an impression of that. So we take an impression tray, we load up this impression material and squirt it around the implant, and then of course fill up the tray and put the whole thing together. After a few minutes, the implant, or the impression rather, is taken out, and I know these colors don't match, but we'd have an impression of the implant impression part, that coping. And if we kind of zoomed in on it, again, this isn't the same thing, it's a different color, we would see kind of the outline to make sure it's a good impression. And everything looks great. Now, this is going to be sent to the lab, and the lab is going to need a couple parts. But before we do that, we have to take this part that we just took an impression of. We have to take that out, and then put that piece that they came walking in with it, put that back in place. So they're going to leave the same way that they walked in. Okay, just now we have the information we need to send to the lab. But this impression part right here is going to be connected to this other thing. We call it an implant analog, or some people call it an implant replica. It's basically going to be the implant that the lab is going to use to construct this actual abutment and crown. Let's kind of walk through these steps, and I'll show you how that's done. They put these two parts together, and they pop this back into place. Remember, this was just the part that was in the patient's mouth that we took an impression of. So now we're going to connect this part, this implant replica, and then we're going to take and pop that back into place. And we do, this little part sticks back up. The lab is going to then fill this in with stone, and then they're going to separate it. And what they have now is this metal piece is locked in the stone, and that's going to replicate just like what the patient's implant looks like in the mouth. So now the lab has a stone model to work on that is a replica of the actual what the patient has in their mouth. And just kind of just go through again how that works. We have the impression of this. We then take that impression out. We take that piece, which is right here. We take that out of the mouth. We take this other implant analog. We put those two together, put these two plus equals that, and take this, flip it over, and pop it right into that impression. Okay. The lab then has the ability to pour this up. So this is no longer the patient. This is now in the lab. They have this green stone here indicating that we are now talking about stone. And here's another example. It's using white stone. And you see this pink thing right here? This is what they call a soft tissue model. This is a little more of a detail in the lab. since the implant is up underneath the gums, the lab has to see what's going on inside there. So when they pour up this area, they first squirt a little silicone around that tooth, and then they pour over the top of that stone. So when the whole thing sets up, the silicone plus the stone, they now have this, which they can peel this pink thing off, and they have direct access to that implant replica. So when they're making their parts, they can look all the way around it to make sure it's sealed all the way. But they also need to know what the gum tissue looks like, so they can snap this pink thing back in place. And they have the ability to take that on and off, so they can make sure that they have everything going on underneath the gum line the right way. But then they can put the gums back on, and they can build the crown out so that the crown's going to have the right contour to fit against what the patient's gums look like. Small detail here, but it just makes it so the overall implant process is more accurate, and we get a much better fitting and better looking crown. Okay, so now the lab has this implant replicas in here. They now are going to take the abutment. This is going to end up being the final restorative abutment that the crown's going to be made upon. This is actually going to be the abutment that's going to go into the patient's mouth. They've got different sizes. They pick the size that looks like it's the right one. They put it in place. They connect it. There's a little hollow area here. There's a screw that goes up and connects to that implant replica. And this is all connected now. Now they can go in and they can take their burrs and they can shape this on the lab model. They can take in this abutment and they can kind of shape it the way that they want it to, so that when they ultimately make a crown, the crown fits on the abutment and it all will fit and look good. Okay, so now the lab has made the abutment, they've made the crown. Patient comes back to the office. Takes about 4 weeks in the lab for this whole process to happen. Again, the patient left last time with this in place. We take that back out. We take the abutment. It's not green, by the way. Okay, this is just for cartoon purposes. But we take this out. We put this abutment in. We slide the crown on, and if everything fits well, then we glue it in place. And basically, they're done. So that's kind of a step-by-step process of what happens with the lab and how that works out. So at the very first appointment after their surgery, they're going to come in and we're going to, let me find it. We're going to take an impression of this. We're going to box it up, send it to the lab. The lab's going to do all that other stuff I mentioned at the middle part of the video. And then when they return back to our office a few weeks later, we have an abutment, we have a crown, we put them all together, and the patient is finished. All right, well, that's it. And we have another module that talks a little bit more a thing called a healing abutment, which will explain how we get this gum tissue to shape the way it does. All right, thanks.